women are underrepresented and underserved in the traditional healthcare system. So most clinical studies, for example, are conducted on men and largely white men. So you're talking about protocols that are often developed and applied to women based on data from men. So that's a broader conversation around just the sort of the healthcare gap between genders. But from our perspective, realistic pressures and burden that most women are dealing with as primary caretakers, primary healthcare managers in their families, also kicking ass in their careers, also trying to juggle everything else. And it's often personal health that gets left behind. And the idea of looking after everyone else around you and letting yourself get neglected is something we hear a lot. Whereas in reality, there's this principle of putting your oxygen mask on first, where you have to be in good shape, functioning well, in control of what's happening inside your body so that you can show up in all these other areas of your life that demand your attention to the best of your abilities. This is also something that comes up a lot in the conversation around menopause. So 100% of women will experience menopause, obviously. Less than 7%, at least in the US, receive any sort of clinical support for menopausal symptoms. And if a woman is experiencing significant menopausal symptoms, she's 15 times more likely to either need significant time off work or have to quit a job entirely. So it's this massive opportunity to actually provide real clinical support that not only improves quality of life, but changes the longevity trajectory for any woman who's experiencing menopausal symptoms, and do that with a new level of openness and support that most people haven't received previously. So that's always been a really important foundation for how we think about building the platform.